Hello, my name is Dr. Eugenia Millender. I am a psychiatry mental health nurse practitioner, a neuroscientist, a university professor, and entrepreneur. I'm here to tell you a little bit about my life and experiences as a nurse. I first chose to be a nurse when I was very early in my age. I was taking care of my grandmother in the Republic of Panama who had diabetes. And ever since, I became very interested in how to take care of other people. And I chose to be a nurse. I have been a nurse for 20 years. And for the last, I would say, 10 years, I have been more involved in research. And I'll tell you a little bit more about that later on. But I want to start first by saying that you always should select something that you are completely passionate about, something that speaks to your soul, to what you want to do, and how you want to make a difference in life. I selected nursing, and it has paid off for me. I have done things at the community level, national level, and international level. So it continues to fulfill my heart, my joy, and as I help others become healthier overall. So I wanted to continue to tell you a little bit about how I became a nurse scientist and university professor and a nurse practitioner. And for me, in order to best do this, to actually also connect it to some pictures and some things that you could utilize in the future, okay? So with that said, first, I'm gonna start by the role that I am currently playing. I am a nurse scientist. What does that mean? Is that I am a researcher. I spend most of my time at Florida State University researching things that specifically relates to mental health and how mental health can be improved or how it can be worsened by epigenetic research and factors. And I just put a little description of what that is so you know what epigenetics is. If you ever hear this word again, it is the study of changes when it comes down to your gene expression. Everybody is born with the same genes, but some genes will work and some may not work. So I look at how those specific things are impacted by mental health and stressors in the environment. As a neuroscientist, I'm privileged to be working with different entities, professions. Even though I'm a nurse, I also work very closely with FSU College of Medicine. So I do work with physicians and physician assistants. I also work with the FSU College of Social Work. I also work with FSU Psychology Department, and I'm also a affiliate faculty at FAMU College of Pharmacy. So what does that mean? That you can work with many different individuals as a neuroscientist as you develop new knowledge. And my knowledge relates more about mental health and how I can improve the mental health of people of color in our community setting. In that role, I also founded the Center for Population Science and Health Equity. So as I researched, I understood that there was a need for us to have a voice in the things that we do. And I developed a center that looks at the different populations and how we see and experience life difference and how that may impact mental health moving forward. I'm also an associate professor. What does that mean? I also teach. I teach one course per semester at this moment. And primarily, I only teach in the psych and mental health program. That is my expertise. Therefore, I teach within that program. I teach the postmaster psychiatry mental health nurse practitioners. These are nurse practitioners. They are already working in the medical field, but want to come back and get a certificate to be a psych and mental health nurse practitioner. I also teach in the doctoral in nursing practice for the psych program. And my expertise in teaching relates to epigenetics, pharmacogenetics, and psychopharmacogenetics. So not only do I do research and find new knowledge, I also teach the next generation of nurses coming through Florida State University College of Nursing. One of the other great things that I love is I also practice. I have my small little private practice, and that's why I say I'm an entrepreneur. So I work for myself. And in that role, I select who I want to see and when I want to see them, particularly when it relates to working with other community organizations. So in this role, I have selected to work with only right now nonprofit organizations that see individuals that are extremely underserved, have no insurance, or have kind of insurances that do not provide them with quality of care. And these are people typically who are homeless, have been recently released out of prison or jail, immigrant populations that are coming to the border and need to be evaluated here in the United States. So 95% of my business is working with nonprofit organizations, and those organizations are at the community level. And I love working with those teams. Since you are really truly giving back, I'm also learning from the clients. They're telling me their lived experiences, and then I take that information and teach it to the next generation of nursing students, because they need to see and understand what the real world is experiencing right now. And I also take that knowledge and then now integrate it into my research. So with that, I also want to give you a little more information about what it is and how long it took me to be a nurse. So I started I actually did 6 years in the military before I started college. But afterwards, with the GI Bill, I started my undergraduate. I got my associates of science first. Then I went and got my bachelor's degree. And then after that, I got my master's in nursing education. I soon realized that I wanted to do more clinical. So then I went back and got my second mental health nurse practitioner. And through that time, I was also going to school for my PhD. So that took another 5 years. So in total, I have, who knows, probably more than 25 years of education. I have been very thankful and grateful for all the blessings that I have received due to the education that have opened many doors. In nursing, as a professor, you could easily make 6 digits. We typically work 9 months. And those other 3 months, you can work more if you want. You could get paid more if you want. You also could make 6 digits as a nurse practitioner, right? You have your own practice, or you could work with somebody else. And obviously, as a community person, that's very gratifying when you go back into your own neighborhoods and provide services that are very much needed. So in nursing, you could potentially do whatever you want. You could be a professor at the university level. You could teach in a local high school, because there are a lot of nursing programs in high schools, in the local college. You could also do administration if you want. All hospitals have administration component to nursing. You could also work at the bedside. You could work with children or adults. You could work in a specialty such as mental health or ICU trauma, like I used to when I worked in St. Mary's Hospital. Or you could work for example, you have specialties related to the kidneys, to the heart, and so on. So the choices are endless when it comes down to nursing. The question is, what is it that you want to do and why you want to do it? And make sure that you do it because you are passionate and you love it. So you could go to school to be a nurse with 2 years, or you could go to school and have many more years and have many more experiences. And to understand that with the more education you have, probably potentially the more choices you have in nursing. One of the things that I want to make sure that you understand is that every school has choices when it comes down to getting a degree. So don't let a school loan or tuition stop you. For me, I had to get a lot of school loans because my parents could not afford school. And a lot of my parents did not know anything about scholarships. So that's why I ended up going to the military, and the GI Bill paid for some of it, but then I had to find funds for the rest of my education. So with that, now that I am a professor, I have a lot of my school loans being paid off through either NIH, which is obviously the National Health Institute, and also through HRSA, which also provides a lot of school loans forgiveness if you work in certain areas that are underserved. What underserved means that the government has seen certain areas in our communities that need more help, and they are encouraging healthcare providers to work in that area in exchange for forgiving or paying off your loan. So look at those things. Another thing I want to mention is that most universities have special programs for minority populations. For example, FSU has the CARE program. And within FSU, that means that you could come in under the CARE program, and we will help you not only make sure that you succeed, but we give you extra resources to make sure you succeed. So when you look at colleges and universities, make sure you look at those things. What kind of special programs they may have minority populations, underserved populations, first generation students, and so forth. So at the end of the day, the choices in nursing is limited. You could do whatever you want. Make sure you do what you really love, and make sure you give back to your community. With all that said, feel free to anytime contact me. My email is emillender@fsu.edu if you have any questions related to nursing at any point. Enjoy.